Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we have a Q&A where we're going to be focusing on tight hip flexors. Is my SI joint really out of place? Why am I feeling so tight in my body? Let's get into it. All right, so today we're just going to dissect 3 or 4 different questions submitted by listeners, people like you. And that is why we want you to ask questions down below, because we love doing these episodes that are Q&A specific, or we will end up doing a full episode on something that a user or a listener submits to us because we haven't done anything on it before. And we want topics that we know you want to know. So please comment below. Make sure you hit the notification bell and subscription button before you go, because what if we answer your question in the future? You want to be around to hear the answer.
So we're answering questions today, and I just want to thank anyone who has ever submitted a question about the podcast. And if you do have further questions about things that you feel like we haven't covered, or you're not sure if we've covered, or you just want to know about, please, this is where we ask you, email jen@jen.health and submit your topics, submit your requests. We want to hear from you. Yeah, you DM me at DocJenFit. You know, I want to hear from you. This is how we know how to create content, or what research we need to dive into for you.
What programs we create, like anything.
Yes,
like a lot of it is generated by listeners, users, people in the community, because then we know that is what you want.
Exactly.
And so, yeah, I love doing these Q&A episodes. I feel like we get to just be a little more off the cuff and say what we think about certain topics. So what heavy hitter can we start in on?
I think we start on one of the top ones, which was a clarification on SI being out of place versus weakness in the area. What's actually going on? And this is something that we have addressed specifically in an episode before.
A full episode on this. Of course, we'll have the full episode linked up in the show notes. But no, in 99.9+% of cases, your SI joint isn't out of place. No. It's kind of course, everyone's an individual and every situation is unique, but the SI joint moves so minimally. And what the SI joint is we have these 2 iliums, which are the big bones that you can kind of feel on the sides of your body, the sides of your hips, and our sacrum that sits right between them. And our sacrum does this thing that they call it nutation, which I never understood. It nutates and counter-nutates, but it does so like millimeters.
Yes.
It moves millimeters in the normal average person or adult. Generally, when we're feeling SI pain, it's due to sensitization.
Yes.
And we are very sensitized in that area.
And there's a lot of ligaments that also help to support this area, which is really cool, right? We have so much structures, not only from the ligaments that hold it all together, but the muscles. We have our huge glutes that really help impact. We have our pelvic floor. We have our hip flexors. We have these huge muscles that all help and connect and hold this pelvis together. So in no way is your pelvis out of place. Unless you got in a car accident.
It's such a deceiving term to say the SI is out of place.
Unless you got in like a severe traumatic accident where we see fractures and an actual movement of the pelvis, in a really severe way. That is not why you have pain. And so if someone is just telling you, oh, something is out of place, that's why you're having pain, we just need to put it back into place, that manipulation, adjustment, whatever they may do, mobilization to help realign your pelvis of what they're noticing is such a temporary neurological quote unquote fix that temporarily helps to relieve symptoms, because we're talking to our neurological system based on some touch and some mobilization, some manipulation that we do directly on the body. And so that helps us to feel like, oh, I have more movement, I have more ease. Maybe I heard a cavitation, I heard a pop, and I feel like I'm realigned. I feel like I'm better because now I can move a little bit better. Maybe now my pain sensitivity has gone down a bit. But that didn't actually put anything back into place. That really just talk to our nervous system to help calm things down. And
I mean, again, we've talked about this on other episodes, just that terminology of out of place, and then you feel better after they do some sort of technique on you. Right. It makes you believe them. It makes you believe like, oh, I must have been out of place, and what they did put it back in place, and that's why I feel better. No, you feel better because all the stuff that Jen just outlined, that you have this neurologic, relaxing effect both locally and globally. We release endorphins. We feel good about ourselves. Like that is the benefit those techniques bring, not being out of place. Another one is like someone saying, oh, your SI joint is stuck.
Yeah.
You know, could be slightly more believable that it's moving less. I don't believe that a provider can tell by pushing with their hands.
Well, and we have studies that show
that's very inaccurate way of determining how much is this joint moving. Like I said, it moves like a matter of millimeters. So how can somebody, oh, yep, this one's moving 3 millimeters. This one moves 6 millimeters. This one must be stuck. It's moving half as much.
Right.
Like they can't tell. And also, is it stuck? Is that the reason it's in pain? Or like even if it is moving less, which again, I'm not saying that people can even tell that. Like, no, the place has been sensitized.
Yes.
Something happened that overloaded the area. We put too much pressure in our low back. We rest into our ligaments or our hip on a certain leg. And we've started to have pain in the area, which then sensitizes the area, which essentially means we feel pain easier in that area.
Yeah.
And now we need to work on desensitizing. Most SI pain issues are due to sensitization of the area.
So what can we do? Well, if we want to take pressure away and like help to reduce some of the sensation and the tension that we're feeling, that's where we could work on mobility. You know, we could work on opening up the hips a little bit more, moving from the hips a little bit better. So maybe we're not putting as much tension through the low back and the SI area. And if we have more mobile hips, we have more freedom of movement in general throughout our pelvis, so it doesn't feel like it's taking on so much pressure. That could be something that helps. So is it necessarily a weakness thing? Doesn't necessarily mean it's weak either. It could just be that we need to open up other areas around that we're a little bit restricted in and we're not moving as well in. It could be that, okay, maybe we want to work on the coordination of our deep core, of understanding how our pelvic floor responds to our movement of our spine and responds to our movement of our entire core from our front to back. And so if we understand how to reutilize this deep core pressure, could it help to take some pressure and tension off of that? Sometimes we do just need to get stronger. We need to get stronger in our glutes and our hips and our low back and our whole core, you know? And then sometimes, like I've worked with a patient before where he was so tight, so restricted, and they just kept saying, you know, it's your SI is out of place. You need to do Pilates. You need to do core work. You need to like strengthen. But here's a guy who like would shake as he's bending forward, shake as he's, you know, his nervous system is so tense and tight. Getting him to do more tension was the wrong choice. We actually needed to get him to relax and release tension and do more mobility focus before we can start strengthening again. So there's never just one answer, unfortunately, but the one answer we do agree with is that your SI is not out of place. It is stable. It is resilient. We don't know if you already, you know, were at a place where you were quote unquote out and now you're having pain for some reason, but this has always been how your pelvis has looked. What came first, the chicken or the egg? So you cannot say your SI is looking out of alignment. This is why you have pain. It's just that the two are not correlated.
Yeah. Again, SI pain, SI joint issues, much more complex topic. Go listen to the podcast that we did on that.
We go into more depth.
Next question. Someone asked about Iliopsoas bursitis.
Yes.
Which I don't feel like I've heard people refer to it as Iliopsoas bursitis as often, like when they're having the pain in the front of your hip. The iliopsoas is the main hip flexor. If you're not familiar, a lot of people talk about having a tight psoas or, I've just got such tight, achy fronts of my hips. What do I do? Again, this is an area where there are so many different ways and so many different things that might be going on. Is it what you're doing throughout the day and how much we're sitting and we're getting so used to sitting that we don't bring our hip flexor through the full range of motion? Is it a mobility or a strength issue? Those are both things that we need to suss out when it comes to the hip. Generally, we go to mobility. Okay, let's check mobility. How is the hip flexor? Great. Then how do we start to control through that full range of motion? Do some hip flexor strengthening. Great. Learning to coordinate that hip flexor with our core can come next. Great. You know, there's such a progression of things that we should be checking to figure out why we're putting too much pressure in that area.
I mean, a lot of the times when just look at how you're standing, like look in the mirror, try not to like make it look a certain way. But a lot of times people will stand forward into their hips. And so we kind of rest forward into our joints. We tend to do that a lot. And so a lot of times we tend to have these tight tightness and restrictions in the front. The quads end up being super tight. We're putting so much pressure in the front of that hip joint. So that's a lot of times why we can get some of that pain, or like that deep hip pain in the front. So that's where I go back to like opening up the back. We want to get our glutes strong, our hamstrings strong, but we also want to get our hips mobile. Go back to 90-90. That's like one of the easiest places to start. Stop digging out that hip flexor. Stop worrying so much about that, but get your hips moving better in general.
And that hip rotation is so important because it's like so closely related, especially hip internal rotation to our hip flexion. And if you have a tight area in any joint, you have to globally look at that joint. And our hip is so complicated because it moves in 6 directions. Yeah. It has all these compound movements. It is incorporated with our core, which is a whole nother ball game, figuring out how to coordinate that mess. We've done, well, there's a lot going on. We've done a podcast episode on tight hip flexors itself. Yes. We also have a free tight hip flexor guide. Yeah, that has so much information to kind of outline all sorts of different things you can look at, different video resources. So go check that out in the show notes.
Okay, one more question that we're going to or I guess we have a couple more questions, but
we'll do 2
one
more.
Of the last ones is someone was saying, is it normal to feel like when you get more tightness after working mobility back into your daily life? And I like this question because, it depends. It depends on your body. It depends on the type of mobility you're doing. It depends on so many factors. Now, first of all, I will say, if you are a super hypermobile person already, your thumb bends back and it's like that hitchhiker's thumb, you can make a bowl with your fingers, your elbow hyperextends, like some of these signs that might lead to you having more hypermobility in your body, and you're just adding stretching, passive stretching, your body doesn't necessarily need more passive stretching. So as a result, it could feel like it tightens back up, right? And so sometimes if you're hypermobile and the mobility that you're adding back in is passive stretching, I would recommend not doing so much passive stretching, working on more active mobility where it's actually harder and it makes your body work a little bit more, and working on more strengthening and stability, because then your body will crave that a little bit more.
Again, like you said in the it depends answer, that's for someone who's hypermobile.
Yes.
Now let's look at someone who hasn't been doing a lot of activity.
Yeah.
Or they feel tight because they're sitting at a desk and they're like, I need to do more mobility.
Yeah.
And they start a mobility routine and they are religious with it. They do it every day. They do a half an hour of mobility, passive stretching, some active stuff. And they're 3 or 4 days in and they're like, oh my gosh, I'm sore. I feel tight. To me, that would be more soreness. Mm-hmm. Like you're loading your body in a way that you're not used to. Mm-hmm. And you're going into ranges with those joints that you may not have done in a long time. Right. And so your body's going to be like, ooh, we need to remodel to be more used to this, so that a couple weeks down the road, a month down the road, we feel more comfortable with everything you're doing. And so again, there's all these different scenarios, and this person saying, I just added this back in. Yeah, maybe they're someone who's hypermobile, or maybe they're more the situation that I outlined, like they hadn't been doing a lot of mobility and now they suddenly throw in a bunch or whatever they're doing and they're feeling a little tightness, soreness. That can definitely be normal for the sedentary person.
Taking a step back, right? Maybe we need to work on a little bit more breath work. Maybe we need to work on a little bit more breath with passive mobility to get your body to relax a tad more, rather than adding a lot of those active components. So it depends on the spectrum that you're at. If you're not a hypermobile person, focusing on more breath and passive stuff prior to adding the active stuff can really help.
And the third scenario I can think of is somebody who specifically has pain in an area. Like if somebody has neck or upper back pain and they do a big mobility routine for the chest and upper back, and they wake up and they're super, super sore.
Their body's guarding.
Your body's guarding because I have this pain.
Yeah.
You just moved around my upper back and neck in a way that was really
never
freaky.
Felt that before.
That was really freaky for me. And then it guards back down because it's like, we need to protect because that was not okay.
Yeah.
That's kind of a third scenario that I can think of.
Yeah. So, always listening to your body, not doing too much too soon, not pushing the most, right? Yeah. If we want this mobility to be in our life long term, start small.
And kind of understand
gradual.
The more movement you do and the more familiar you are with exercise, you start to understand the difference between a normal soreness after exercise or working out and something like this, which might be more like of an insidious tightness, like something's not right here.
Yeah.
I shouldn't be feeling this way after doing mobility. And that's your guide on, okay, I need to maybe take a little step back, do something different.
Or change it up.
Have a slightly different focus. or change it up. Last question we got was just best programs on our platform for knee and plantar fasciitis.
Yes.
And it just so happens that we're focusing this upcoming month of May on the knee plan. On Gen Health with our Gen Health community. We're going to encourage anyone who has ever had knee issues or just wants to focus on general knee health and figure out what they can do to optimize knee health into the future. I know I have already had knee issues. I had knee issues in sports. I'm excited to take a look and go through the knee plan day by day with the community because it's a 30-day plan. There's multiple phases and you can start your first week for free, and also you can get your first week for free and then get the first full month for $20 using code OPTIMAL, because our podcast audience always gets a little special discount. So $20 for that first full month to go through the knee plan. And we've had so many people give such good feedback on how it really helps you learn and how it helps you learn where those restrictions are really coming from.
And I just want to remind you, it's like 5 to 15 minutes a day. So I'm really not trying to add a ton. Like, I get it, 2 kids, trying not to add a ton to your day or to your life. So people don't realize too, you just step in, just hit the play button. You're going to learn, and you're going to learn about your body as you move and open up, because we're working on ankles, we're working on feet, we're working on knees, we're working on hips, we're working on core, working on everything that helps to stabilize and bring more attention and resilience back into your knee. And so that's what we're trying to do here. So I love this plan, and it's helped so many people. So I hope that you get in.
Yeah. And I guess second part of their question was plantar fasciitis. Also in that membership that you'll be in when you join the knee plan, we have a foot and ankle plan. That is great. There are multiple phases of that as well to help you start to address some of the restrictions in your feet. And outside of that, we have an incredible Barefoot mini course that we've gotten feedback from so many different people saying, this is the one thing that has been able to help me address my plantar fasciitis. That course goes really detailed in helping you assess all the components of your feet, ankles, and beyond, and address them with certain exercises if you have restrictions there.
Thanks so much for joining us. I hope that you learned a ton. And if you have more questions specific to anything about the body, we want to hear from you, because this is how we create new episodes, dive into the research, get into the nitty gritty that you might not want to get to, but you do want to learn and understand. So drop it in the comments, and don't forget to hit subscribe and the notification bell.